Welcome to Part 3 of the Patient and Family Advisor Orientation video series, How to Communicate Effectively as a Patient and Family Advisor. In this video, we'll talk about why good communication is so important to your role, as well as some rules of thumb for communicating in a spirit of partnership, including listening, offering feedback in a sensitive way, and working as a cohesive group. As a volunteer on a Patient and Family Advisory Council, you're part of a group unlike any other in the hospital. In the PFAC, patients, family members, staff, and leaders work closely together to consider programs and policies that impact many people who come to the hospital. Because it is a place where people share experiences that they feel emotionally connected to, it's very important to make the PFAC a safe space where people can share their perspectives and their ideas openly. One way that we create a safe space in a PFAC is by offering feedback to people who are presenting their ideas in a sensitive way. Let's talk about some rules of thumb for offering feedback in a sensitive way. First, it's helpful to share observations, that is, things that can be seen, heard, touched, or smelled, instead of beliefs that might not be based on facts. For example, saying, "I saw trash on the floor," is an observation about something that can be seen. Saying, "This hospital is dirty," is a belief and doesn't offer any information that's helpful for fixing the issue. Another rule of thumb is to frame your feedback as a request instead of as a demand or an argument for change. For example, asking if it would be possible to offer a class on Saturdays is a way to offer an idea while acknowledging that there may be reasons why it isn't doable. Saying you should offer a class on the weekends may make some people feel defensive. Having conversations with open dialogue and not making assumptions is another good rule of thumb when offering feedback. Asking, "Have you tried changing the signs in the parking lot?" is a way to be curious about ideas that have already been tried and may help others in the room to contribute their own ideas. Saying, "People are lazy and they'll park wherever they want," is a negative assumption and shuts down further ideas. The final rule of thumb for giving your feedback is to show empathy and an appreciation for the challenges that others have faced in trying to make the patient experience better. Avoid wearing the expert hat or bringing in information to make yourself look more qualified or knowledgeable than others in the room. Saying, "I'm sure you've thought about this," before you share your opinions and ideas shows appreciation for the work that staff members and others are doing. Bringing in facts and figures or experience that isn't related can make other people feel intimidated or defensive. Now that you understand how to share your feedback and perspectives in a spirit of partnership, let's take a look at a video of a PFAC meeting. As you watch, pay close attention to how the staff members and PFAs communicate with one another.
Dr. Bob and I are happy to be here. We have some new program ideas that will enable us to keep our patients safe from falls. We are open to any feedback you have.
I can't believe you let patients fall in this hospital. Falls should never happen. Your nurses must be very irresponsible.
We don't want them to fall. That is why we are working on these new programs. We want to reduce our falls to be below the national average.
I am glad you are working on this. Have you already considered how you can better engage and educate the patients and families to prevent falls?
Yes, Lee, I was wondering the same thing. My grandmother fell here and I often think about how things might have been different if my family and I had been given ways to help.
You should create a program to make sure patients don't fall. I can't believe you haven't done that already.
But we did. That is why we are here.
My friend fell here and broke her hip. Then she got an infection. After that, her 80-year-old husband had to push her in a wheelchair. Falls are bad, I used to manage 100 employees. If I was in charge of this place, no patient would ever fall. It is a simple problem. You should work harder to fix it. It seems like you just don't care very much.
I do care. That is why I am here.
I know this issue is complicated and patients fall for many reasons. Would you mind telling us more about the procedures for answering a call bell in a timely manner?
Yes, thank you for asking. Let's talk more about call bell response time strategies as well as ways we can better engage our patients and families as part of the team.
Thanks for coming. We had a rough start to this conversation, but I think this was very helpful for us. I hope you got some useful feedback. Please come back to share how things go.
We love your ideas. We'll be back after we implement your suggestions. Thank you.
Now let's explore what you saw and heard in this example PFAC meeting with some discussion questions. What phrases did you hear from the patient and family advisors that communicated positivity and a spirit of partnership? What phrases did you hear from the PFAs that were negative or unhelpful? What else did you notice about the interactions between the PFAs and staff members in this meeting? If you're watching this video in a group, you may want to pause it and take a few minutes to discuss your answers to these questions. If you're watching it on your own, take a few moments to write down your thoughts. As we've seen so far, sharing your feedback in a sensitive way is important to helping the group work together. Before you speak your thoughts, take a moment and ask yourself, is what I'm about to say true? Is it helpful? Is it kind? Of course, sharing your experiences and perspective is only one part of communication. Let's quickly review some other tips for communicating in a spirit of partnership and working as a cohesive team. Listening is an equally important part of communicating. In the PFAC example we saw earlier, you may have noticed that everyone had a chance to speak and that everyone's perspectives were respected. This is an example of good team communication. In our PFAC meeting example, we also saw two ways to respond when someone makes a negative comment or a complaint. One way is to get the conversation back on track by sharing an idea. The other way is to share a personal story that is related to the topic of discussion and includes helpful information, such as what would have made the experience better or an idea for change. Both of these communication strategies can help reinforce the idea that PFAs are there as partners, not to criticize healthcare staff who are working hard to improve the experience for patients and families. Speaking a common language is another important part of working as a team. This can be a little bit of a challenge in a healthcare environment because healthcare professionals are used to talking to each other using medical terms and abbreviations. If you ever find yourself in a PFAC meeting where it's hard to understand all the healthcare jargon, you can use the timeout gesture or raise your hand to ask for clarification. As a team member, it's important that you feel welcome and able to participate in the conversation. By practicing these communication skills, you're helping people to see the benefits of partnership, making the PFAC a force for change in healthcare. Thank you for everything you do.